Hey, glad you could stop by. Grab a cup of coffee and let's talk about EMS quality. There's a lot of one-size-fits-all approaches to a wide variety of things out there. We see a lot of standard adult dose medications. There's a lot of standardization in the way products are manufactured. We even have standardization in the initial EMS training program curricula out there. And these one-size-fits-all approaches can serve a very useful purpose when they meet a need efficiently and effectively. But that's not always the case. Consider a scenario in which we have two paramedics come out of the same EMS training program. After graduation, they may end up working for different agencies in different communities, different parts of town, different shifts. And this will lead to very different experiences. One of them may end up working in an urban core area with a high proportion of urban trauma. Others might go to a more retirement type community with a high proportion of cardiac calls. Or, they may end up in a more rural area with lower total call volumes, longer transport times, and a much higher proportion of high-speed vehicular trauma. Yet in spite of these experiential differences, they'll oftentimes end up in the same or similar types of continuing medical education programs or CME programs. And that might not meet their needs as well as it should. One of the things we try to do in quality management is better align the design of a process with the needs that process is trying to meet. And this is probably a good example where there's a gap. So how might we get past that? Well, one way is to start thinking about CME like a prescription. Consider doing an individual assessment of an EMS professional's knowledge and skills across their scope of practice, and use that to identify their relative strengths and weaknesses. In some areas, they may dramatically exceed the minimum standards, and their CME prescription for those topics might be directed at a more advanced level. Other areas, they might not be as strong, and their CME prescription in those areas might be at a more refresher level. Comprehensive CME needs assessments coupled with a CME prescription. Give that a little bit of thought while you finish up your coffee, then go out and try something.